Epidermal dysplasia verruciformis, also known as E.V. Treman syndrome, and Lewandowski-Lutz dysplasia, named after the physician that first documented it, Felix Lewandowski and Wilhelm Lutz.
This is an extremely rare disease that occurs when wart-like lesions cover the body. This is an inherited disorder and most commonly passed down in an autosomal recessive manner, which means 2 copies of an abnormal gene need to be present in order for the disease to develop.
This disorder predisposes patients to widespread HPV infection. HPV is a group of over 100 different viruses that can be contracted from physical contact, sexually transmitted, in some cases from mother to child. A majority of these viruses cause warts and are associated with cancer.
According to Dr. Gaspari, an American dermatologist, widespread skin eruptions of flat to papillomatous wart-like lesions and reddish-brown pigmented plaques on the trunk, the hands, the upper and lower extremities, and face are typical. 30 to 70% of these patients develop malignant tumors.
The most common of this is a type of cancer called squamous cell carcinoma. Dr. Gaspari explains that studies show patients with EV have a defective cell-mediated immune system to HPV infection. Many HPV types found in EV lesions are non-pathogenic to the general population.
Research shows that about 7.5% of cases present their first symptoms in infancy, 61.5% in childhood between the ages of 5 and 11, 22.5% in puberty, and the rest in adulthood. By 40 to 50 years of age, malignant tumors start to form in about 1/3 of patients, and this is shown to be the cause of most fatalities.
Unfortunately, this is something anyone can be a target of. For many years, it seemed that EV only occurred in men. There was not one case involving a woman. Then in 2017, a 10-year-old from Bangladesh was the first and only female diagnosed with this disease. It also seems it can affect any race of people. There has been cases found in Eastern Europe, Latin America, Poland, Romania, Indonesia, Bangladesh, and more. Although no cases has been found in the United States, there is no proof that it is not possible.
The best way to describe what life would be like living with this disease is describing the life of an Indonesian man named Didi Kaswa. With warts that had multiplied on his hands and feet for over 20 years, his life was extremely difficult to live. Normal tasks such as picking up a fork or making a fist became impossible. This forced him to make a living in carnivals where he became known as the Tree Man. Dr. Gaspari traveled to Indonesia to treat Kaswa. With the growths on his arms weighing over 12 pounds and the warts on his feet, he was not able to get around well, and he often became exhausted when he tried. Gaspari explains, with good reason, he was a sad man. He was getting infected and had insects living in the base of the wood-like material. Kaswa was afraid that the warts would make their way to his face and prevent him from being able to see or eat.
In 2008, his story was told on ABC's Medical Mysteries. Didi underwent surgery that same year that removed 96% of the warts on his body. As the warts regrew, he continued to have procedures, but these were only served to be a temporary solution. As anyone could imagine, this is a terrible way to live. Sadly, in January 2016, at age 46, Didi Kaswa died from a complication related to his condition.
As of now, there is no cure for this disease. Once someone is diagnosed with EV, there are only preventative measures that can be taken to help the lesions from rapidly worsening or surgical options to make the person more comfortable. Some of the preventative measures that can be taken are avoiding UV exposure, skin creams, systemic retinoids, which is an oral medication used for severe skin disease, and interferon, which is an animal protein that prevents virus replication. Unfortunately, with some of these treatments, the side effects are very unpleasant. Some of the surgical options that are available are the removal of benign and pre-malignant lesions, meaning non-cancerous, skin grafting, and also treatment for any malignant or cancerous lesions. Even with all that is available in terms of treatment, none of these yet offer a cure for this rare, fatal disease.